Let's test and build your critical thinking on oxygenation fundamentals with this 5-question practice quiz. Guys, if you find value in this content, go ahead and hit the like button, okay? And don't forget to drop your final scores in the comment section. And remember, hit pause in between questions if you need more time to think the answers through. Let's go. Question 1. A nurse is assessing a client admitted with acute respiratory distress. Which of the following clinical manifestations should the nurse recognize as an early sign of hypoxia? So the correct answer is C. Early signs of hypoxia includes restlessness, tachypnea, confusion, tachycardia, use of accessory muscles, and tripod position. Cyanosis, bradypnea, and bradycardia are late signs of hypoxia. Question 2. A nurse is caring for a client who requires high-flow oxygen via a non-rebreather mask. Which action must the nurse take to ensure proper device function and client safety? So the correct answer is B. When given high-flow oxygen via non-rebreather mask, the oxygen flow rate must be high enough, around 10 to 15 liters per minute, to keep the reservoir bag inflated and prevent CO2 buildup. Question 3. While assessing a pediatric client with sudden respiratory distress, the nurse hears a high-pitched, harsh whistling sound over the upper airway that is audible without a stethoscope. How should the nurse interpret this finding? Remember to pause in between the questions if you need time to think the answers through, okay? The correct answer is C. Stridor is a high-pitched, audible whistling sound caused by an emergent upper airway obstruction such as anaphylaxis or epiglottitis and requires immediate intervention. Question 4. A nurse is preparing to collect a sputum specimen for culture and sensitivity from a client with suspected pneumonia. Which of the following actions should the nurse plan to take? So the correct answer is C. You want to instruct the client to rinse their mouth with water before collecting the morning specimen. This should be done after the client has rinsed their mouth with water while positioned in Fowler position and strictly before starting antibiotics. Okay, question 5. A nurse is providing discharge instructions to a client with chronic obstructive pulmonary disease who is prescribed long-term oxygen therapy via a nasal cannula at 2 liters per minute. Which safety instruction is most critical for the nurse to include? So the answer is C. Safety considerations for home oxygen strictly prohibits smoking or having flammable items near oxygen equipment due to fire risk. Humidification is only indicated for flow rates at or above 4 liters per minute. That's it for this video, guys. How many